Now, South African sexologist Dr Elna Rudolph has been appointed president of the 25th Congress of the World Association for Sexual Health. The Congress takes place in Cape Town later this year. Well, this year's theme is Leave No One Behind. Dr Elna Rudolph joining us now here on All Angles to talk about what she's going to focus on. Dr Rudolph, good morning, and thanks so much, and congratulations on being appointed. It really puts South Africa on the map, I suppose, as well, that you hold this position. What does this actually mean for you, and what does it mean for those in this sphere?
Well, firstly, it means a lot of hard work for me. Basically, everybody thinks I'm crazy to have accepted the job, because it's a lot of organization. But what it means for Africa is it's the first time that the World Congress for Sexual Health comes to Africa. And it's about time, really. We have such pertinent issues related to sexual health in Africa, and the African voice hasn't been strong enough internationally. So it's my job to make sure that we include topics, speakers, symposium, feature the NGOs that are relevant to the African context and really bring Africa to the world. But also, at the same time, bringing the world to Africa. We want to have like the highest standard of sexual health knowledge coming to our local healthcare providers and activists and people who are interested in sexual health in general.
Give us some insight then into what's top of mind, what's a priority, what's pressing when it comes to sexual health in Africa. What are people dealing with or battling with?
We will have the theme Leave No One Behind because we are looking at people with disabilities, for instance. They also have the right to sexual pleasure. The right to sexual pleasure is actually a very hot topic at the moment, and we thought that the people in Africa might be like, we need the right to reproductive services, for instance, but they are all like, no, give us the right to sexual pleasure. So we'll be talking about that, but we will talk about sexual and gender justice as well. The fairness that there needs to be in people's ability to access sexual health services and everything that their sexual health entails. So it's really a very broad topic, and we will have more than 100 online lectures on covering all of these topics, as well as live lectures where there will be world experts doing plenary sessions. So I really am very excited about this. You will have the full bouquet of sexual health topics there. Well,
this will happen in September, we understand. So hopefully, our situation with regard to COVID-19, to the pandemic, would actually have changed, or we will see significant improvement by that time. Who knows where we'll be. But Dr. Rudolph, what has the past year, what impact has it had on sexual health? You will be hosting this Congress at a very interesting time. What has it shed light on? What has it highlighted for us, or changed for that matter, in terms of sexual health that you will have to probably find yourself having to deal with then?
Yes, so the first thing is, unfortunately, we will have this conference fully online. And I'm saying unfortunately just because I would have loved to have all my friends in sexual health from all over the world here in South Africa and give them the full South African experience. But we will, due to COVID, we thought that it will be unethical to try and get like 2,000 people into a room, even if it was allowed at that time with the vaccine situation and everything. So it will be online, but with a very much African flavor, and the Southern African Sexual Health Association, SASHA, is the host organization, and that's how I got to be the president, because we have a local, I'm representing the host organization. So what has happened is, previously, if you wanted to learn something about sexual health, you had to get on a plane and go to an international conference. But thanks to COVID, the community health worker in Kampala can now actually attend this conference, where it would have been impossible for them to attend it, because it will be around $100 US, and we will also be helping people from Africa to, I think for them it will be $70, and there will be some sponsorships available. So thanks to COVID, we are really in a position where we will leave no one behind. There has been very interesting things academically, where cyber sex has escalated and gender-based violence has escalated, and the rights of people, for instance, sex workers, have really they haven't been able to access their rights due to COVID. So there are lots of things, good things and bad things that happen, but at least I think we will be able to reach more people with this.
Well, Doc, I suppose on the other side of this coin, a lot of people probably wondering, with everything that the world has to deal with at the moment, we're dealing with such serious things. We're dealing with this pandemic, for one. If you look at other countries on the continent here, there's poverty, there's hunger. Why should sexual health be something that we actually need to concern ourselves with right now?
Sexual health concerns every single person on the planet. Even if you're asexual, then sexual health concerns you, It is such an integral part of being human, and your sexual rights are actually part of your human rights. And, if you sit in a conversation, you will hear that it is important to every single person. So I think it is really important that we keep our humanity here. At the heart of all of us, there is a sexual being. And we have to talk about how those rights can be accessed and how, if there is infirmity, we can improve it. And, there's a lot to talk about. We obviously sit for hours and hours and talk about these things and think that it is actually, even now in this time, more important than ever before.
All right, thanks very much, Dr. Elna Rudolph. We look forward to some feedback when this Congress happens later on this year.